Hello there. Thank you for joining me for this week's edition of Telile 24/7. I'm your host, Adam Cooke, and this week we're looking at healthcare from two different perspectives. In the second half of our program, I'll speak with two members of the Alzheimer Society of Nova Scotia. January, which is just winding down, is Alzheimer's Month, so I thought it was a good idea to bring in people from two different parts of the province, including Cape Breton, to talk about what the Alzheimer Society provides in terms of services and how the disease's image has changed over the past 10 to 20 years. But we begin by taking a look at a recent announcement involving healthcare professional recruitment in the Strait area, specifically provincial funding that's been made available to the Cape Breton South Recruiting for Health organization. In just a few minutes' time, you're going to hear from Richmond PC MLA Trevor Boudreau about the funding announcement and about different aspects of the current state of the healthcare system here in Cape Breton Island. But we begin with Gina MacDonald, the Program Director for Cape Breton South Recruiting for Health. I was able to catch her on the phone just after the announcement was made. Here's what she has to say about the funding that's being provided to her organization and how it's going to help physician recruitment efforts over the coming weeks and months. So the reason we're talking to you today is because of provincial funding that was made available last week by the Department of Health and Wellness. A number of different recruiting programs like yours are able to take part in the funding, which is designed mainly in terms of communications and promotions. But can you give us a sense on exactly what this funding will allow you and your office to do and the importance of that particular movement?
Yeah, I'll give you a little lead up to how the funding came about. So the Office of Healthcare Professional Recruitment was established about a year and a half ago. They have been consulting with a group of provincial navigators over the course of the past roughly 9 months. We have met with them several times to establish what the general needs are of communities in the province, as well as how those needs will differ from community to community. And then we met with them individually to discuss what the individual needs were for our particular community, so specifically Richmond County and the town of Port Hawkesbury. So through these consultations, the community fund was established, which will allow all different communities across the province, even those without an existing framework for recruitment and retention work, to hold different initiatives and to establish programming for their particular area. So as that applies to Cape Breton South, we have submitted a funding proposal to the Office of Healthcare Professional Recruitment, and were awarded just north of $74,000, which was part of the project stream. There were two streams of funding, one of which was the project stream specifically for the types of work that Cape Breton South Recruiting for Health does. The other stream wasn't as applicable to us because it applies more to organizations without the existing framework that we already have in place. So things like getting a committee together if it's not already in place in the community. But like I said, because we already have that framework and because we have an employee, me, in place to carry out the work, we submitted to them a proposal for the different project funding that we wanted to undertake for 2023. A lot of that will include, actually I'll break it down into two sections. So we have major projects and then the smaller projects. So the major project funding is a 4-part proposal on our part. The first project will be a Business of Medicine course for 2023. We did hold this event in 2022. It was extremely successful. It's a partnership between Cape Breton South Recruiting for Health and Doctors Nova Scotia, where we take some first and second year residents from the Dalhousie University Family Medicine program and take them to a community in Cape Breton South. So last year it was in St. Peter's. This year it will be either in Port Hawkesbury or in Ayrshire, and it will introduce them not only to the community and to the healthcare facilities, but it will also give them an introduction to how to run a medical practice via the facilitators from Doctors Nova Scotia. So they will let them know how to do billing, how to hire staff, how to all of the tax implications involved with running a business, how to onboard their patients, all of that type of thing. So that's the business of medicine course, which we hope to hold in either the late summer or early fall of 2023. The second large project is the Community of Care Awards Gala, which, again, we did hold in 2022, and we're expecting to expand on that and increase our guest list. That event will honor different healthcare professionals in the Cape Breton South healthcare community for the work that they do. That event will probably be sometime in April. Another large project will be a radio campaign, which we are partnering with 1015 The Hawk in order to secure some airtime for it will vary depending on what project we need publicized and what kind of message we're looking to send out at that particular time. The advertising team from the Hawk is fantastic, and we are going to work with them to put together a campaign that will really suit our needs here in Cape Breton South. And the last major project will be a professional promotional video. So that will be specific to our healthcare facilities and our communities in Cape Breton South, and it will act as a recruitment tool and also as a promotional tool for our area. So that will be taking place at some point in 2023, and we hope to have that out and published sometime early in 2024. So those are the major projects that the funding will go toward. In addition, there are a great many smaller projects, which include mostly community visits for residents and for other healthcare professionals, accompanying Nova Scotia Health recruitment consultants with their site visits around different areas in the county. We also have recruitment fairs that we're attending. We will have recruitment appreciation gifts. We will have a newcomers social. We're going to have lots of different activities that really kind of target exactly what the needs of this particular community are in terms of recruitment and retention for specifically Richmond County and Cape Breton South.
All right, so you folks have hit the ground running with these projects, so we're excited to hear that, and we'll obviously hear more about that as the weeks and months go on. Can you give us a bit of a snapshot, Gina, as to where we are in terms of vacancies that need to be filled? There was a real problem for months with the Strait-Richmond in terms of nursing vacancies in addition to physician vacancies, and this has impacted other clinics around the region. What can you tell me about where we are now in that regard?
I can't really tell you that much officially. I don't have, I'm not privy to all of the human resource information that Nova Scotia Health keeps. I know that there have been several vacancies at the Strait-Richmond specifically that have been filled in terms of nursing, and also that there have been a few locums to come through to have a tour to decide whether or not Strait-Richmond might be a place they'd be interested in doing some locum coverage. Whether or not those are secured, I couldn't tell you, but we are hopeful. I know that the impressions that we've made have been great. It's just a matter of math at some point, and whether or not Nova Scotia Health is able to secure those resources to come to our sites. We do have a physician who will be starting at the Port Hawkesbury Collaborative Clinic in a few weeks, who is a candidate from the Practice Ready Assessment Program. So he will be starting a 3-year return of service in Port Hawkesbury starting, we're hoping, sometime before the 1st of April. We have had another cohort of Practice Ready Assessment candidates go through just within the past week, so we're hopeful that one of those will end up matching with their site and that we will have another physician practicing in the area come September. Although these are optimistic, we are hopeful that this will happen, but we're not really able to give any confirmation until it happens.
Of course, we'll see how things go then over the days and weeks to come there. One last question for you, Gina. This might be a short question with a long answer, but we'll see how it goes. Much hoopla late last week when Premier Tim Houston announced in Sydney that a new medical school would be opening up at Cape Breton University. Does this help your office, or is it too early to tell whether this will have a long-term impact on the work that you and your colleagues at Cape Breton South are doing?
I would say that without knowing exactly what the returns would be, of course it's going to be helpful. One of the main reasons why we don't have as many candidates that exist is because there aren't enough residency seats and there aren't enough seats in medical schools. So we are hopeful that this introduction of, a new batch of medical students in the province, that's only ever going to help us. I don't know yet what the parameters are of the acceptance into the program, but I'm assuming that just the existence of this program in Cape Breton will also go a long way toward encouraging students in Cape Breton to maybe looking toward a career in medicine when they're in high school here, where they have more exposure to a program right at their doorstep.
The healthcare system here in Nova Scotia has been in the headlines quite a bit over the past few weeks, and not always for good reasons. To address this, and also to talk about the recent funding made available to the Cape Breton South Recruiting for Health organization, we are pleased to welcome back to Telile 24/7 Richmond's Progressive Conservative MLA, Trevor Boudreau. We are pleased to welcome back to Telile 24/7 the MLA for Richmond. He is, of course, Trevor Boudreau. Trevor, thank you for making some time for me on Telile 24/7 today.
Thanks for having me, as always, Adam. It's always a pleasure.
Well, it's no trouble at all. And one of the reasons we did want to have you in today is to talk specifically about healthcare and also about a recent government announcement concerning funding to one of the groups that's been set up in our area to try to fill gaps in healthcare professional recruitment. Obviously, we're talking about Cape Breton South Recruiting for Health. And just last week, it was confirmed that the Department of Health and Wellness is providing funding to Cape Breton South Recruiting for Health. We've talked to Gina MacDonald, the program director, a little earlier on in the show, but can we get your viewpoint on why this funding is so important to what Cape Breton South Recruiting for Health is doing and how it's going to help them as they try to bring new doctors, nurses, and others to the Strait region?
Well, that's a great question, Adam. And I think I can go back in history a little bit with my time with that group. I mean, our region has seen recruitment and retention of healthcare providers as essential to kind of making sure, we have an opportunity to provide the best care possible to residents of Richmond. And so, before there was ever kind of funding for these types of groups, like a really hardcore amount of funding, we started that group. It was kind of a group of counselors from both Richmond and Port Hawkesbury town councils, as well as a lot of healthcare providers in the area. And so, I think our government has been pretty clear, like retention and attraction is a very important component of getting this healthcare ship right. And we've created that, that office of recruitment and attraction, and then put some money where our mouth is. So we put $2 million to support these types of initiatives and groups in our province. So certainly there's been a few announcements. I believe, Brian, there's been announcements in CBRM, there's been announcements in Annapolis Valley, I believe in Cumberland as well. And so, we're looking at all of the applications that are coming in and saying, how do we help the people on the ground, the grassroots people, support them in their efforts to retain and attract healthcare providers. So it's great news, something that certainly I'm very excited for. And I think that group is very eager to use that money to support those initiatives. And so very pleased, glad to hear that announcement. And it's something that myself and that group have been working on for a bit.
Now, you mentioned your history with Cape Breton South Recruiting for Health, and obviously you were one of the architects of that association as a town councillor for Port Hawkesbury in your previous life in municipal politics. I'm just wondering what the relationship has been like between yourself and Cape Breton South Recruiting for Health, and what kind of a two-way communication has been happening between your office and their office since you've become MLA for Richmond. Can you give me a sense on just what the communication is like and how it's going from there?
Certainly. I mean, I correspond quite regularly with the council representatives, both Warden Amanda Mumbercat and the council for Richmond, but also, with my time on Port Hawkesbury Council, I certainly keep in close contact with Mayor Brenda and that crew as well. But Gina MacDonald and I, we bounce ideas off each other all the time, and I think Gina has done a tremendous job of trying to promote and encourage the mandate of that group. And I have kind of an open door policy with her, like I have with a lot of other groups. I want to make sure that she feels comfortable reaching out to me, and we chat, not daily, but I would say fairly regularly. So if I hear something coming down the line, I certainly let her know that's coming, and the same idea from her. If there's somewhere that she feels I can be of assistance, I certainly take that role and go with it as best I can. So I'm not on the committee anymore, but certainly I like to know what's going on and keep up to date, and they're doing some great things. So.
Now, I wanted to talk to you as well, because this is the first chance I've had to speak to you since the Minister of Health and Wellness, Michelle Thompson, and several members of her department and the Nova Scotia Health Authority came to the Port Hawkesbury Civic Centre in December as part of the minister's tour of community consultations around the province. And I know that she had appeared in Inverness earlier that day as well. You were there. You were co-hosting the event with Minister Alan McMaster, your colleague as the Inverness MLA in the PC caucus. What did you think about the conversation that happened that night? And more importantly, where do we go from here in terms of taking those concerns and having them be a part of the healthcare conversation?
Yeah, no, I said it kind of at that meeting, and I certainly would say it again. How often has the primary major health team of the province gone around touring to see and hear the concerns of residents and constituents and business owners and healthcare workers. And so this is really their second tour. They did a tour visiting healthcare facilities across the province with the premier the year before, and you're limited where you can go, and so certainly they wanted to hit some other areas that they didn't hit on that first tour. And so it was a bit of a different kind of approach than it was the first time, which was going and hearing specifically from healthcare workers that first time. This time was about giving some information about what's going on behind the scenes and what's going on in local areas, but also to hear the concerns and questions that certainly residents have. And there was a multitude of questions, and I think it was a well-received event. The minister and certainly the CEO of the health authority and the deputy minister were there to answer questions. And so, how often do you get the chance to do that? And certainly some of those questions were locally concerning, talks about whether it was the Strait-Richmond hospital or talking about kind of the possibility of pharmacies taking on bigger roles with nurse practitioners. I know Michael Hatt was there and had some great conversations, but at the end of the day, it was to make sure that we hear from different communities, because every community is a bit different in terms of their needs and their wants. And so, I think the minister, being a minister of the Strait area, understands. We talk regularly about kind of the concerns that I have, and certainly the concerns that I hear from constituents, but really, being there in person to be able to have those conversations is nice too. And where does it go from here? I mean, a lot of the ideas like that's, and I think the CEO of the health authority said, we're here to listen to ideas. And if there's something that we're willing to try anything. We're willing to see what types of opportunities are out there and what can we try in different areas. And some of them have become pilots in the province, and that's how you learn about what works in certain areas and what doesn't work in other areas. And so healthcare is complex, but it's also so important. So you can't take your foot off the gas. It's about keeping going. And I think the premier has sent that very message loud and clear over the course of the last year and a half. It's not moving fast enough for him. It's not moving fast enough for Nova Scotians, but we want to get it done. And he's committed to making sure that we give it our best foot forward, trying to support residents and healthcare workers. And, that's our mandate. That's what we were elected on, quite frankly. And we're going to continue to push that agenda.
Speaking of the premier, he made some waves late last week, giving the State of the Province address in Sydney. And one of the things that he shared with the public at that point was the forthcoming creation of a new medical school at Cape Breton University. From the outside looking in, your thoughts on the impact that this could make in terms of being able to fill healthcare vacancies, not only in Cape Breton, but around the province?
Yeah, no, that's a great question, Adam. And I would tell you that I have a little bit of experience in this, and I'll explain it in a little bit. But what a wonderful announcement for Nova Scotia, but Cape Bretoners and any Nova Scotians, young Nova Scotians who are looking at medicine as a profession, right? So part of the idea with this is to get physicians trained, but physicians that have a unique perspective and want to go to rural, want to be in Nova Scotia and are Nova Scotians. So I don't know if you know much about what's called the Northern Ontario School of Medicine, but there is a medical school that's based out of both Thunder Bay and Sudbury. And that medical school was designed for very similar reasons. It's about training physicians in rural areas, getting them in those rural areas and wanting them to stay there. And I actually had gone through the process of applying and interviewing at that medical school back in the day. And I can tell you that medical school has been a success about pumping more doctors that want to practice rural medicine in rural Ontario. So, it's not a quick fix. This was not designed to be a quick fix. And a lot of political fixes are quick, right? Politicians are there for 4 years. They often have this mindset that this is 4 years away. Well, if we have that up and running by 2025, that's 4 years after that. No medical school graduates are going to be starting until 2029, which doesn't help us today, but it will help us in the future. And certainly it's a long-term investment with long-term ideas, understanding there's a short-term need as well. So we still have to do that recruitment. We still have to do that retention. And this is part of that long-term vision of having a sustainable healthcare system.
Trevor, we're having this conversation at a time where the headlines concerning healthcare are grim more often than not. We've heard about the deaths of patients waiting in emergency rooms at the Cape Breton Regional in Sydney and at Cumberland Regional Hospital in Amherst. The number of Nova Scotians without a family doctor has shot up to 129,000. Obviously, your government is trying to take the steps to correct all this. And you did mention to me, you've mentioned it a number of times over the past couple of years, trying to fix healthcare is like eating an elephant, one bite at a time. It would seem to a lot of observers that the elephant is currently covered in kerosene and has been set on fire, and that your forks have been replaced with chopsticks. So it feels like the job is a little harder right now. So what do you say to your constituents or to anybody watching who are seeing these headlines and seeing these concerns and saying, look, we know this is a tough slog, but we're in it for the long haul, like you say, not just for 4 years. We're here to try to get this done and make it better over the long haul.
Yeah, and it's, there's a lot of dark days before you see the light, and sometimes when it comes to situations like that, your heart goes out to family and the friends and the staff that were working at those facilities who want to provide the best care possible. There is not a healthcare worker that is in Nova Scotia working right now in an ER that doesn't want to provide the best care possible. And I feel for all of the people that were involved, especially those families, but certainly I want people to know that, when you can access care in Nova Scotia, you're gonna get top quality, top notch care by some of the best practitioners in the world. Right, we are very fortunate here, but people have a right to be concerned. Right, healthcare has been on the decline, and certainly, I've said this before, and I hope most people know I'm a healthcare provider. My wife is a healthcare provider. We've seen this coming for quite some time. One of the motivations for me running was specifically because I saw the deterioration of healthcare. That was before the pandemic. That was before all of this happening. We've seen it, and it's a slug. And and the premier, in his address to the province last week, and he in the media availability they had soon after these two incidents, he feels responsible. He wants to make a difference. The intent is there to change this, and we've put a lot of good ideas in place over the last number of years. We've spent a lot of money, but money doesn't solve all the problems quickly. And and then for the minister and the CEO of the health authority to sit there for 2 hours after. Maybe it was early last week or the week before. My days are getting mixed up, but
sure.
Having that two-hour conversation saying, here are the things that we've done. Here are the things we're going to do. Here are some of the immediate steps. And we can talk about patient advocates in the waiting rooms. Doesn't sound like a lot, but that's who's going to check on people to make sure they're doing okay while they're in the waiting rooms. Talking about virtual care in the ER system. So some of those people who we'd call let's say level 4s and level 5s that maybe aren't emergencies, but maybe we can have virtual care for them so they don't have to sit around and stay in the ER for very long. Having tuition rebates for paramedics. So trying to hire more paramedics, get them learning in different parts of the province, not just in Halifax, getting them learning close to home and giving incentive for them so that our paramedics are there and they're moving people in and out at a better rate. And so like, these are all good initiatives and they're all going to take time. You know, if I was to pull, you know, there's no secret. HR is the biggest issue facing healthcare. It's the number of nurses we have, the number of doctors we have, the number of lab techs we have. You can go on. And at the end of the day, it's an HR issue. And if you go around talking to other businesses, they're having that in a lot of other industries as well. So we have a plan to get more CCAs. Our recruitment team is scouring the globe, I will tell you, to look for more nurses. We've talked about the increase in number of seats for medical schools and creating that medical school, but this is a grind, and there are days, I will tell you, that I feel the pressure and I feel the anxiety, and there's nothing more that I want to see done than get healthcare fixed. And you know, that when you get to that bottom of the barrel, it's tough, and you see these things. And I would tell people, you know, it's okay to be upset, but what I would say is, you know, let's all work together to make sure that our healthcare workers know that they're valued. We want them staying in those professions. We want to make sure it's a profession that people feel is still noble, is to be a healthcare worker, whether it's a nurse or a doctor or you know, a chiropractor, whatever. And really it's about all of that. And you know, there's lots more we could talk. I could spend hours talking about healthcare and how I want to see scopes of practice expanded. And I can talk to you about what chiropractors could do and pharmacists can do. And, you know, and there's some great things that we're looking at. And so I would say, stay tuned. We're not done yet. And we're going to continue pushing. The budget's coming. You're going to see there's going to be more healthcare initiatives coming as well.
So in the meantime, Trevor, just as we're wrapping up here, we have been hearing from some corners about discouragement among the general public in terms of being able to even go and get care at an ER or at a doctor's office or anything like that. What do you say to people who might be saying, well, there's no use in going to the Strait-Richmond, or there's no use in going to St. Anne's or to the Inverness Consolidated or any of the other local hospitals or doctor's offices, just to counter that feeling of throwing up your hands and saying, well, forget it, I might as well just stay home. I'm not going to get the proper care anyway.
No, I would tell those people, you know, be your own advocate and get the healthcare you need. Like whether it's mental health care, whether it's, you know, you broke an arm, whether it's an ear infection, you know, you have to take your health seriously. And sometimes something that seems trivial could be something that's not, or sometimes that something that seems big is, you know, something that has an easy fix. And, you know, if the ER is closed here, it's because we don't have the staff to properly take care of the number of people that need care. So you may have to go further for it, but I would say do that, right? So don't not get healthcare because you feel it's hopeless. You really do. We really want people to make sure they're getting the healthcare they need, and certainly there are other practitioners that you can reach out to. So I used chiropractors before, but I would tell you pharmacists have a wonderful scope, and they are wonderful resources, and we have them all across this province who are very educated, know what they're doing. Have those conversations with other healthcare providers, and maybe they can lead you in the right direction based on the symptoms that you're having. We also have, you know, virtual care for a lot of people. That has been quite successful. We also have, you know, toll-free numbers that you can call to speak with a nurse. And so I would say utilize the things that are easily accessible if you can't get to those ones that aren't, and understand if it requires you to go further for an emergency or to get that care you need. So it's the long answer for saying don't neglect yourself. Take care of yourself, and we want people to use the system, and we want the system used right. So and we're going to keep pushing to make sure that all Nova Scotians have access.
All right. We've covered a lot of ground here, Trevor. And as you mentioned, we could talk for a few hours about this type of thing. But did you want to add anything else before we wrap up here?
No, I just want to say, though, I think you asked some good questions about, you know, making sure people are aware of what's going on, and healthcare is in crisis, right? we're fully admitting that. And so, but we do have plans to try and make a difference. And so I want people to feel that you are in the right hands. I've said it before and I'll say it again. We have the most competent and qualified health minister in this country. And I will tell you, they're working night and day to make sure that Nova Scotians have the healthcare they deserve. And so we're going to keep up that fight. And it's easy to kind of say it's overwhelming, but it's that fight or flight mode. I'll tell people you keep fighting to make sure people have what they need. So we're going to continue that fight. I can promise you that.
Well, we appreciate you taking some time for us in the middle of that fight, both as an MLA and as a party in government. Thank you so much, Trevor Boudreau, for sorting through all this with us and for joining me here on Telile 24/7 today.
Anytime, Adam. And again, thank you for having me today.
Trevor Boudreau is the Progressive Conservative MLA for Richmond, and we've been speaking to him from his home office via Zoom. Stay tuned for more of Telile 24/7 in just a moment. And we'll wind up this edition of Telile 24/7 by taking a look at Alzheimer's disease and its treatment and its image here in Nova Scotia. January is Alzheimer's month. So as we wind the month down, I thought it was a good idea to speak to two directors from the Alzheimer's Society of Nova Scotia. One of them is based right here in Cape Breton. She's Catherine Shepherd, one of a number of community coordinators that the Society has placed throughout the province. From her office in North Sydney, she also overlooks the First Link program for the Alzheimer's Society, and we're going to tell you what that is in just a few minutes' time. You're also going to hear the perspective of Kirstie Creighton. She is based in Wentworth, and she is the Alzheimer's Society's Manager of Education and Belonging. And you'll be hearing from her in English and French as we conduct a special bilingual interview for Telile 24/7. Before we begin, I'd like to thank the people at the Seniors Take Action Coalition for their input and suggestions on this particular conversation for Telile 24/7. So here I am speaking to Catherine Shepherd and Kirstie Creighton of the Alzheimer's Society of Nova Scotia right now. I wanted to start with you, Catherine, because obviously one of the things that we do want to center on is the presence and treatment of Alzheimer's disease in Cape Breton. Can you shed a little light on the importance of your position for Cape Breton Island, but also what kinds of things you and your office and your colleagues look at in terms of Alzheimer's disease and its general presence here?
Yeah, so I'm one of the many community coordinators that are across Nova Scotia. I just happen to be here in Cape Breton. And our goal is to support persons living with dementia, their care partners, and also healthcare professionals who are on this journey with dementia. So whether you are a person living with the disease, supporting, guiding, and caring for someone with the disease, our goal is to provide some information, some education, and some resources. Knowledge is power. And when we know better, we do better. So being that person that someone can call, that we can reach out to offer a public education session, perhaps we can direct people along to programs and services that we have available. It lets people know that they aren't alone. We have an aging population, and age is a risk factor for this disease. And so the more we talk about it, the more people know that there are resources available. The other opportunity when we talk is to let us take some of the stigma out of this disease. We want people to know that they are not alone. We want people to know that there are resources and that we are here to help.
So let's pick up on that a little bit. And one of the reasons that I wanted to have the two of you in today was to speak about the education and the destigmatization, as you mentioned, of Alzheimer's disease, but also busting some myths about Alzheimer's. And one of the things I really did want to talk about, you mentioned the aging population. We feel that here in our part of Cape Breton, in Richmond County and the general Strait area. Is there a misconception out there that Alzheimer's is an elderly person's disease, late 70s into 80s, when we know it can strike much earlier? What do you think of that particular misconception?
Yeah, I think, we know that as people get older, that their risk, it can go up for this disease. But the truth is, we have lots of people in our community who are much younger that are being diagnosed as well. The Alzheimer's Society right now even offers, a young onset support group virtually that allows people who are younger than sort of that, what people think about as that older age, right? Being diagnosed in that older age. And so we do have people who are much younger being diagnosed. And so they have different conversations that they want to have. Maybe they want to talk about, their young children or still working, and sort of the things that tie in with that younger age diagnosis. And so there are certainly some myths, but, if people have any questions around, is this a truth or is this something that I'm just hearing? I always encourage people to phone and talk with someone at the Alzheimer's Society. Our information and support line offers, anywhere from masters in counseling to social work to death and grief doula. And so anywhere along that journey where people are, we can meet them and have that conversation that they need. So in getting ready for a doctor's visit, in talking about, is this a myth or is this a truth? Or what can I do to help keep a healthy brain? What are some of the things that we can do? Wherever people are across the province and across the journey with dementia, we're happy to help.
Can I pick up on one point you made just a moment ago, the idea of a death and grief doula? And I think some of our viewers might be aware of the presence of doulas for the delivery of babies, but can you explain how that process works in terms of death and grief and the later stages of Alzheimer's and dealing with that for families?
Yeah, so I think it's really important that we make a little distinction here to say that, grief and loss don't just happen at the end of this journey. We have people who are facing what we call ambiguous loss and ambiguous grief as soon as a diagnosis is made. And what I mean by that is, physically the person is still here, but they're changing. And so the relationship is different, where people thought they would be at a certain point in their life may be different. And so those feelings of guilt and grief and loss are very common along this journey. And it's not just sort of at the end. So helping people understand that those are normal feelings, letting people know that it's okay, right, to feel this way, and support them across that is really important. And so that's why when we talk about grief, we don't just talk about it at the end of a journey. We talk about it, as ambiguous loss throughout the course of a diagnosis.
All right. Thank you for helping us to clarify that. I want to shift things over to you, Kirstie Creighton, if I could, partly because I'd like to talk a bit about your particular job title. You are the Director of Education and Belonging for the Alzheimer's Society of Nova Scotia. Can you speak to us a bit about that and how important each of those two very specific things are, education about Alzheimer's and the feeling of belonging for those who are struggling with it and for their families and their loved ones?
Excellent question, Adam. And actually, it's a new job title, Manager of Education and Belonging, just sort of over the last 6 months. So I think at the Alzheimer's Society, this whole notion of belonging has become, everywhere in the world actually, come to the forefront, and we're no exception at the Society. So the belonging part of my word is really, we want to have someone at the organization who's intentionally focused on making sure that all Nova Scotians on the dementia journey feel like they belong with our organization, feel like they can call us no matter where they live in the province, no matter what their language to a certain extent, no matter what their culture is, that they see themselves in us and feel like they belong as part of the services and information that we offer. So that's the belonging part. And then the education part is, we've been doing education for years as an organization. And I think we just wanted to pull that out. I think Catherine's got it in her title somewhere too, but we wanted to sort of at the manager's level have the word education in a title because it's a focus of what we do across the province.
And in that spirit, one of the reasons we wanted to have you participating in this conversation is to reach out to our viewers of Telile Community Television who have French as their first language. Il y en a quelques gens dans notre communauté d'Île-Madame, de Comté-Richmond, qui parlent français comme leur langue maternelle. Pouvez-vous me donner quelques exemples des services que vous pouvez donner et la Société d'Alzheimer de la Nouvelle-Écosse pouvait donner à ces gens, à cette personne qui avait des difficultés en anglais? Can you tell us a little bit in whatever language you choose about some of the services you offer to those who speak French as their mother tongue?
Bien sûr, bien sûr. Donc, tous nos services ne sont pas malheureusement à date disponibles en français, mais toutes nos ressources, toute l'information qu'on partage avec la communauté sont traduites en anglais et en français. Donc, ça c'est tout fait en français. On a 2 personnes qui travaillent pour la société, comme moi puis quelqu'un d'autre qui habite dans un autre coin de la province, qui offre de l'éducation en français. Donc, on travaille souvent à travers Réseau Santé, si vous connaissez Réseau Santé, pour faire des éducations pour le public en français. Puis, je pense que c'était l'année passée, justement, que j'ai fait quelque chose à l'île Madame. Donc, je pense que c'est dans votre comté.
Oui.
Donc, il s'agit juste à nous appeler sur notre info line, puis on va vous donner le numéro plus tard, puis commander des services en français, puis on va faire notre possible. Puis c'est surtout au niveau de l'information qu'on peut partager avec vous et aussi de l'éducation pour des publics, comme des sessions comme ça qu'on peut offrir en français. So just give us a call and ask the question, and we'll do what we can to offer our services in French, and just also a plug for other languages as well. So we do have information in not so much our educational sessions, but we can offer information in other languages as well.
Okay. Just quickly, any services available in Indigenous languages such as Mi'kmaq? Is the Alzheimer's Society reaching out to those communities as well?
So I've been working for the past number of years, mainly with our communities in Cape Breton, because that is my home base, but across the province as well. We've had connections across the province as well. And we've been able to create, some culturally relevant and respectful materials in collaboration with our communities, with the communities of Cape Breton and Nova Scotia. We've created a rack card, a specific rack card that is available. We've also been able to modify a product that was called originally the All About Me, and the All About Me with collaboration from the First Nations communities. We created what's now called The Story Is Mine. And so what that booklet does is it allows people to tell the story of who their person with dementia is. It then allows that family or connect to take the Story Is Mine book into other areas where that person with dementia may be staying, being supported, whether it's acute care or long-term care. And it allows those that are caring for them to know a little bit about who they are, what they like, what they don't like, what their normal routine is. And so it really allows us to provide that person-centered approach to care, putting that person with dementia in the very center and making sure that those that support and guide and allow them to know a little bit about who they are, what they like, what they don't like.
All right. Well, it's good to hear that. We look forward to seeing how that develops in the weeks and months to come. Kirstie, I'd like to shift it back to you for just a moment, because I've spoken a bit about this with Catherine, just the idea of education and the perception of Alzheimer's in Nova Scotia. Given that that is a key part of what you do for the Alzheimer's Society, could you give us a sense about the changing face of Alzheimer's here in Nova Scotia, or at least the changing perception? Do you feel people are more aware now than they might have been even 10 to 20 years ago? Et pourriez-vous donner quelques mots en français au le même sujet, la perception de Alzheimer's ici à la Nouvelle-Écosse pendant les derniers 10 ou 20 ans?
Bien sûr. Justement que c'est en train de changer ces perceptions-là. Dernièrement, on a une étude qui est sortie qui s'appelle le Landmark Study, qui parle beaucoup de ce qu'on va avoir dans l'avenir. Justement, Catherine n'a pas parlé de ça, mais donc ça parle un peu de l'avenir des maladies neurocognitives à travers le Canada. C'est en train de changer beaucoup, comme Catherine vient de dire. Ce n'est pas surtout pour les aînés, ce n'est pas surtout pour les personnes de 70 à 80, 90 ans. On voit de plus en plus des plus jeunes dans leur quarantaine, dans leur 50e, année, qui reçoit un diagnostic de maladie neurocognitive, justement. Donc, c'est en train de changer qui a ce maladie-là, puis aussi, c'est en train de changer comment on comprend ça dans la communauté, puis comment qu'on peut aider le monde, les familles, les proches aidants à prendre soin et à aider, justement.
Okay. Merci beaucoup. I wanted to ask each of you, and whichever one of you wants to answer the question, feel free to jump in. Just basically what the relationship is between the Alzheimer's Society of Nova Scotia and Nova Scotia's Department of Health and Wellness. We're obviously seeing a changing face of healthcare here in Nova Scotia and efforts to make healthcare more accessible to all those who need it. How does that apply to Alzheimer's disease? What do either of you think about how the provincial government has been working with your society to improve treatment and recognition of Alzheimer's at this stage?
We're working very, very closely with the Department of Health, Nova Scotia Health. They realize that it's something that's very real in our province, and I think we have a common understanding that our organization can do a lot of good. So we're working very, very closely with them on this issue. Catherine, I don't know if you're sort of more on the ground, maybe you have something to add to that, but we're definitely working together on it.
Yeah, I think, I think that's very nicely said, Kirstie, to say that, we are working, they acknowledge the great work that we bring forward as the Alzheimer's Society and the need for it in our province. We are a nonprofit charity organization, but we are funded. We do have some funding from the government to allow us to be able to provide some supports and resources, not only to persons living with dementia, their care partners, but also to healthcare. And so they acknowledge the work that we're able to do and bring forth and to kind of partner together in creating and collaborating.
All right, I'd like to stay with you, Catherine, for just a moment, because one of the first things that I found out about you as we began this conversation is you're not only the community coordinator based in Cape Breton at this point, your office is in North Sydney, but you're also the director of First Links. And for those who, like myself, don't quite know what that is, what exactly is First Links and how does that help the Alzheimer's Society carry out its mandate?
Yeah, so as the provincial lead for our First Link program, what that does is this program allows our allied health professionals across Nova Scotia to make a direct referral to the Alzheimer's Society of Nova Scotia. So if they have anybody who is newly diagnosed, on the journey with dementia, having some questions or concerns, even, towards the end of the journey, end of life, it allows them to step in and say, let me take this little bit of stress away from you. With your permission, I can send a referral to the Alzheimer's Society, and then the society will take that referral and will connect with the person that needs it the most. It basically is a program that lets people know that, just like the name says, that this is the first link in just a long chain of support. And so as a healthcare professional, whether it's a doctor, a nurse, an NP, a social worker, an OT, a PT, a dentist, a pharmacist, anywhere in between, it allows folks to connect, and it takes the onus off the person who already has a really full plate, to connect with supports and resources. One of the things that we hear when people connect is, I wish I had known about you sooner. And by a health professional making that referral, what we have found is people connect to the society about 11 months sooner. And when we stop and think about 11 months, and for somebody who is, struggling to understand, trying to figure out what to do next, worrying about what may happen, 11 months is a really long time to live in that. And so as a health professional, being able to take that off of somebody's plate, right? I can see there's stress or distress. Let me take that off your plate and let me put this onus on someone else now. You don't need to worry about a number. You don't need to worry about making a phone call. You don't need to worry about any of that. Someone else is going to do that for you. So as a health professional, this First Link program simply allows you to connect your client, your patient, to our services, as long as you have their permission. If you view our website, people will often say, well, how do we do that? And I say, well, head to the Alzheimer's Society of Nova Scotia website. And it's a pretty easy website. It's a click and point, and it's easy. The nice thing to know, though, it is evidenced and research based. We all use Google, but sometimes we don't come across the best resources. By connecting into our website, it will connect you not into the supports and resources available, but also information about the First Link program and the referral form that's there. I jokingly say I've been in healthcare 23 years of my life, and when people say referral forms, I kind of shudder. But this is probably one of the easiest referral forms I've ever seen. It's so easy to fill out. You can fill it out online, you can email it to us, or you can fax it to us. And so it's a nice, easy way to connect as well.
That all sounds very efficient and very easy to use. You knew I was going to ask this question. Is the program available in French?
I'll say it in English first, just
sure.
So the info line where the first contact is made is not available in French at this point. But if someone is calling and really requires a service in French, we can begin the conversation in French. Donc, on peut commencer la conversation en français. Malheureusement, jusqu'à date, tous nos services, le service de infoline, comme on vient de parler, n'est pas disponible en français. Mais c'est sûr qu'on peut au moins commencer la conversation en français, le soutenir avec des ressources en français, et dépendant de vos besoins, ça se peut que ça pourrait continuer en anglais à cause de l'expertise de mes collègues. Mais pour dire qu'on peut le commencer en français, bien sûr.
We've covered a lot of ground in a short time, as I thought we might. Is there anything that either of you would like to add about this, particularly as we move out of Alzheimer's Month here in January and look to the future? Any final thoughts just before we close?
So one of the things I will say is, no matter where you are on this journey, whether you've just been diagnosed, or whether you've been living with this disease, or whether you're just, looking to know more, wanting to know more about what I can do, what modifiable risk factors that are, we can talk about to keep a healthy brain, call us. We're only a phone call away. We have all kinds of resources and education materials. We have trained staff that can support and talk over the phone. We can mail information out, but we also have tons of events that are happening that are either in person or what we call a hybrid world, which is virtual and in person. One actually happening on the evening of January 31st, tomorrow night. Mm-hmm. And so if people want to attend a support group, if they want to come out and, attend a public education session, if they would like to learn more about Artful Afternoon, which is a program that happens through the society, all they have to do is call, and we can, talk through what's available, let them know what's in their area. If they do want to attend something virtual and they're a little unsure with how to do that, we can support that as well. And so it all starts with a phone call. Our phone number is 1-800-611-6345. And we're just a phone call away.
Kirstie, le dernier mot est à vous. The last words to you, whatever language that last word happens to be in. Any final thoughts?
Je suis chanceux. Juste pour dire, just to say, no matter what your language, no matter what your culture, no matter where you live in the province, nous on travaille pour soutenir, pour aider toutes les néo-écossais. So we're here to help all Nova Scotians on the dementia journey. So feel free to call us. All that Catherine just said stands true. And if we need to make accommodations or alterations to our programs to meet your cultural linguistic needs, we will do that.
Well, it's been a great pleasure to speak to the two of you, and we want to thank you for giving us some time in each official language of Canada to discuss Alzheimer's disease and also the services of the Alzheimer's Society. Thank you so much, Catherine Shepherd and Kirstie Creighton, for joining me on Telile 24/7 today.
Thank you so much for the opportunity.
Thank you, Adam.
Catherine Shepherd is a community coordinator based in North Sydney. She is also the provincial lead for First Link for the Alzheimer's Society of Nova Scotia. And Kirstie Creighton is based in Wentworth. She is the manager of education and belonging for the Alzheimer's Society of Nova Scotia. We've been speaking to them via Zoom, and we thank the participation of the Seniors Take Action Coalition for helping us to prepare for this panel discussion. And there you have it. That wraps up this week's edition of Telile 24/7. Thank you for tuning in, and a special thank you to my interview guests this week, Trevor Boudreau, Gina MacDonald, Kirstie Creighton, and Catherine Shepherd. If you have any thoughts or comments about what you've seen on Telile 24/7 over the past hour, or you'd just like to make suggestions for a future edition of the show, I'd love to hear them. You can contact me directly. My phone number is 902-625-8863, and you can reach me by email using the address adamjrcook, cook with an E, @gmail.com. You can also contact Telile Community Television directly with your comments and suggestions. The station phone number in Arishat is 902-226-1928, and the best email address to use is telile@telile.tv. Don't forget to follow Telile on social media. We're on Facebook, Twitter, Instagram, and YouTube, as well as a new TikTok channel. And our YouTube channel features every single episode of Telile 24/7, including this one, as well as individual interviews and stories from our various shows. You can also see our sister program, Roundtable, and several other great new programs that my friends at Telile Community Television have been putting together in recent weeks. For now, I'm Adam Cooke. Thank you once again for joining me for this week's edition of Telile 24/7. I look forward to seeing you again next week with a brand new show. Bye for now.